Well, welcome. Good afternoon. Thanks everyone for joining us. I'm Tom Landy. I'm the director of the McFarland Center for Religion, Ethics, and Culture at the College of the Holy Cross, and I'm pleased to welcome you for a discussion on structural racism and the homeless crisis with Holy Cross alum Ron Lawson. Earlier last summer, the Black Lives Matter movement and the ongoing protests triggered by the police killing of George Floyd and many others prompted the college to articulate its commitment to anti-racism. In conjunction with that effort, the McFarland Center hosted online conversations with young Holy Cross alum who were doing work that I deeply admired to dismantle structural racism. We had Malik Neal from the class of 2013, who's director of the Philadelphia Bail Fund, talk about injustice of the cash bail system. And Malik just had a great op-ed in the New York Times last week. If you didn't get a chance to see it, it was fabulous. Rashonda Tyson, class of 04, was a teacher, administrator, and former student in the Hartford school system, talked about the challenges of urban education. Jerry Dickinson from the class of 09, a law professor at the University of Pittsburgh and recent congressional candidate, focused on fair and inclusive housing policies. These were really great talks. They're still available to watch online on our website. I have to confess, for those three talks, I took the very easy step of picking three students who I knew really well as students. They're not students anymore, but I knew them as students. And when we decided that it would be important for me to continue to build on the success of those events, I realized I had to go outside that group of students who I knew for some talent. Next month on March 9th, we're going to host Damon Hart of the class of 1996 and Dominic Blue of the class of 1998. We're both student athletes at Holy Cross and now executives in the insurance industry for different firms. We're going to talk about a huge fund that they're helping to create to support the work of nonprofits in Black and Brown communities in Massachusetts in the areas of healthcare, housing, economic opportunity, education, and youth empowerment. So I hope you'll join us for that. All of us have been really, I hope we have been genuinely horrified by depressing examples of some of the most egregious forms of racism. Killings, things that threatening or demeaning encounters that recur and that have necessitated responses like Black Lives Matter. Those forms of racism obviously surely warrant our attention and our energy. At the same time, many of the factors that profoundly impact Black and Brown people's life chances are slower, perhaps less explicit, sometimes bureaucratic and hard to pin down. They're pernicious. In the academy and elsewhere, we describe these factors as structural racism. Structural racism refers to a whole array of norms, policies, and social priorities that are racially biased in far less apparent ways than are visible at a hate crime. They could be biased in deliberate but subtle ways, or maybe inherited by us and thought of as neutral, just the way things are. And they could even be invested with a strong, plausible deniability that they're really racial in intent. But ultimately, they do bias benefits toward people with racial privilege and away from people without it. The effect of structural racism is clear. The intention is sometimes harder to prove. Eliminating those forms of bias is complicated, hard work, but it's also highly consequential. And it's the work that I think that highly educated Holy Cross alums are particularly capable of carrying out. So I've tried during this series to draw attention to some alums who have, so that our current students will be inspired to do the same. And today we have a chance to think about structural racism as it intersects with homelessness. Ron Lawson, who's here with us today, is Chief Operating Officer at Care for the Homeless in New York City, which provides healthcare, shelter, and advocacy for almost 10,000 members of New York's homeless population. Ron graduated in 1975 with a degree in political science and earned a master's in public policy and management from Heinz College at Carnegie Mellon University. For 14 years, he worked as a financial analyst at some of the biggest firms on Wall Street. And then, during the recession of the early 1990s, he suddenly lost his job and found himself homeless. He spent 6 months without a job or home before he was recruited to work for New York City Mayor David Dinkins' re-election campaign, where he became the chief financial officer. From that opportunity, he rebuilt a career in operations, financial management, and consulting for nonprofits. Ron joined Care for the Homeless in 2016. The organization runs 26 healthcare sites across the city, operates a 200-bed shelter for women, It continues to open shelters and safe houses. Ron just told me about I think it was a $50 million initiative they're working on. Active in the Holy Cross Alumni Association, Ron has recruited so many Holy Cross students as interns and staff to care for the homeless that his boss refers to the organization as Holy Cross South. And you'll see he's wearing purple today. Today, he'll talk about how the homeless crisis of New York City, about the history of it, about how local, state, and federal laws and policies have contributed, and the impact of systemic racism that it's had on homelessness. After his presentation, we'll open for questions, and I'd ask you to submit any questions to me through the Q&A function, and I'll pass them along to Ron. I'll also mention that today's talk is being recorded and streamed through Unity Radio through one of his classmates, Ernie Floyd. So welcome, Ron Lawson. Thank you.
Thank you, Tom. I'm honored to be here and offer this presentation. And Danielle, if you could show the first page. I want to be clear that this presentation was prepared by my boss, George Nashak, who's the president and CEO of Care for the Homeless. He's been in this field his entire adult life, so he really has fine-tuned this document, so it really speaks to pretty much how homelessness started in New York and how we got where we are. So I just want to make sure I give him due credit because this is his presentation, but he allows me to give it, and I will interject some of my own personal experiences while doing it. Could you go to the next page, Danielle, please? So, late 1900s, awareness grows about homelessness in New York City. As a result of the rise of immigration into the city at the end of the 19th century, the first homeless facility or facility to accommodate people experiencing homelessness was created by Jerry and Maria Macaulay. They opened Helping Hand on Water Street, which is down in the Battery. It's now a rescue mission, a soup kitchen, a shelter, and a food bank. In 1879, the Bowery Mission was founded, which is also a soup kitchen and shelter, and has houses 325 people. These two entities still exist today, and they're combined, and they are now called the New York City Rescue Mission. In 1879, the Tenement House Act was created, and this was the first attempt to try to provide some stability and structure around how tenement houses and tenement buildings were built in New York City. In 1890, Jacob Riis wrote his seminal book called How the Other Half Lives, Studies Among the Tenements of New York. And then in 1901, the Tenement House Act was revamped, and now it was charged with, it banned construction of dark, poorly ventilated tenement buildings. And I think if folks on the call can remember The Godfather 2, you remember that scene where Vito is getting ready to kill the head of the mafia family and how he's climbing through all the tenement buildings and he's in this dark apartment complex. That's how the vast majority of low-income folks lived in New York during the turn of the 20th century. Next page, please. So this is going to speak to depression and federal housing intervention. In 1930s, as a result of the Great Depression, shanty towns started popping up and being created across the country where homeless people who had lost their jobs would live. What you're looking at in this photo is actually Central Park, and it's the Great Lawn. So any of you all who have ever come to New York City or been in New York City and gone to a concert in Central Park, this is where that normally takes place. This was totally demolished during the 30s, and all the homeless folks were just kicked to the curb and removed. In 1934, the National Housing Act was created. And this was a function of the New Deal. And I'm going to read an excerpt that I downloaded that speaks to this law. The assistance program not only limited recipients of the funding to white Americans, it established and then reinforced housing segregation in the United States, effectively drawing lines between white and Black neighborhoods that would persist for generations. For example, in 1940, the FHA denied insurance to a private builder in Detroit because he intended to construct a housing development near, not in, near a predominantly Black community. The FHA only wanted to insure houses in white neighborhoods. So what did the builder do? In response, he constructed a half-mile long, 6-foot-high concrete wall between the Black neighborhood and where he planned to build, thereby assuring that this wall would keep the neighborhoods racially segregated. The FHA then agreed to insure his housing development. In 1934, New York City Housing Authority was created. And then we have 1945. 1945, at the end of World War II, the GI Bill was created. But that bill didn't benefit everyone. It explicitly discriminated against African Americans. And if you go to the History Channel's website, they have a great read about how the GI Bill was denied to 1 million Black World War II vets. Now, I can speak personally to this. My father served in the Philippines during World War II. He came home in 1945. He could not participate in this program because he was African American, so he could not buy a home. He told me the story when I was little about how we lived in an apartment in the South Bronx. He and my mother would drive out to Long Island to look for housing, and they found a house, and this is 1953. They found a house. He couldn't afford it. He told my mother he couldn't afford it. She broke down crying and wouldn't stop and was inconsolable. And he literally got out the car, went back into the model home and gave the person a $10 deposit. And that was in a section of Long Island called Wyandanch, predominantly African American. That was in 1953. He came out of the service in 1945. So he wasn't able to get a home for 8 years. So that was 8 years. He was unable to build equity by having home ownership. Can we go to the next slide, please? Now, these are some laws created in New York. 1954, the New York City Local Law 24 prohibited creation of new single-room occupancy hotels. Single-room occupancy hotels in New York are structures that provide someone with a room and maybe a shower and a toilet that's commonly used by everyone on the floor. When they struck this law and prohibited it, all those folks that were on the fringes and on the margins, where that was the only kind of housing they could afford, wound up on the street. In 1955, the New York State Psychiatric Center census was 96,000 individuals getting psychiatric care. And in 1955, the New York State decided to start deinstitutionalization of those residents. Now, please keep that 96,000 number in mind, because I'm going to refer back to it later on in the presentation. Next slide, please. So 1963, early 1960s, protests movements start. Of course, 1963, August, the March on Washington. I remember my mother and father's friends going and me sitting on the floor in our basement when they came back and told us what an exhilarating experience that was. And this period, Voting Rights Act 65, Selma to Montgomery marches, which is called Bloody Sunday, which most folks know about. This was my first introduction to Jim Crow because my grandparents lived in Jacksonville, Florida. And when we would get on the train in Penn Station to go to Florida, we were fine until we got to Washington, D.C. Once we got to Washington, D.C., we had to get up and go to the back of the train, even though we paid for the same price for the same ticket that everyone else had. Once we got to Florida, to Jacksonville, I remember seeing the colored-only waiting rooms, the colored-only drinking fountains. There used to be this pseudo Disneyland kind of place called Silver Spring, the Spring of Live Mermaids. And so I was really excited about going. My grandfather took us, and we couldn't go in the main entrance. We had to drive around to the back to the speed up, decrepit parking area, and then got in the same boats that other people got into to go out into the same spring that everyone was in. So it was an interesting experience and exposure to me. When we would go clothes shopping, other kids could try on the clothes. I couldn't because I was Black. My grandmother either had to buy the clothes or not. And if they didn't fit, so be it. And we couldn't return them. This experience, the March on Washington, is also interesting because John Vaughn, who graduated in 1981, is now the executive pastor of the Ebenezer Baptist Church, which was Martin Luther King's church. And his mother was the first Black tenured faculty member at Holy Cross. 65 is the Social Security Act, was amendment to create Medicaid and Medicare. A lot of the funding that Care for the Homeless gets for the patients that we serve, we receive reimbursements from Medicaid for that. And then in 65, Housing and Urban Development, the Department of Housing and Urban Development was created. Next slide, please. Now in the late 60s, you start seeing professional services to address homelessness and to provide advocacy for those folks experiencing homelessness. The Manhattan Bowery Corp, which is now Project Renewal, which is a great sister institution of ours, started a medical detoxification program for quote unquote public inebriates in the Bowery neighborhood of Lower Manhattan. And this used to be a strip of New York City where you would see nothing but alcoholic men 7 days a week, 24 hours a day. So this was the first step to try to mitigate that problem. Then in 1960, Project Find was founded, and this was to advocate for those folks in those single residency occupancy hotels we talked about. Next slide, please. Now, government intervention takes place. Fair Housing Act of 1968 was basically an attempt to reverse the discriminatory effects of the National Housing Act of 1934. Governor Rockefeller signed draconian sentencing laws for drug possessions and drug sales, which incarcerated an innumerable number of young folks. And then the Section 8 program was authorized by Congress. And this was to benefit low-income wage earners with opportunity for housing. Now we see a sharp increase in homelessness in the 1980s. The Friars for St. Francis Friends of the Poor converted the hotel into supportive housing. Callahan versus Carey was a consent decree establishing right to shelter for single homeless men. So if you were a single homeless man in New York, you had a right to shelter. We still follow Callahan rules and regulations now in all of our shelters, and we actually call them a Callahan review. Eldridge versus Koch extended the right to shelter 1 year later, 2 years later, to homeless women. And then in '83, the Legal Aid Society sued New York City over the conditions in the emergency assistance units. The EAUs are the places where homeless folk go to try to begin to receive services by the city. And quite often, there were legions of homeless folk stranded in these assistant units for days, weeks at a time. 1985, Mayor Koch announced a 10-year plan to build 15,000 affordable housing units. Next slide, please. In 1981 to 89, the Reagan administration reduced the HUD budget drastically by close to 80%, with the thinking that, or the theory that anti-poverty programs, in fact, created poverty. The first budget slashed $1 billion for the aid to families with dependent children. Drastic reductions in public housing construction occurred. And then in 1988, the police moved out homeless folk who were encamped at Thompson Square Park, which is in the Village. And that led to days and days of protests. In 1988, New York State raises the shelter allowance for single adults to $215 per month, the last time it's been increased. Now, this $250 is what someone in a homeless shelter is being given by the state to use for housing. Very difficult to find housing in New York for $215 a month. Next slide, please. In 1985, the Robert Wood Johnson initiates the Healthcare for the Homeless demonstration project. Care for the Homeless, it grew out of that demonstration project. And 35 years later, we're now a $38 million organization that serves 8,000 to 10,000 people experiencing homelessness annually. Because our philosophy is housing, healthcare is housing. If you're healthy, you're more inclined to be able to find a place to live. 1986, the federal legislation created the Low Income Housing Tax Credit Program. This provides $8 billion annually to states for them to provide tax credits for developers that are building low income and affordable housing. And then in 1986, the appellate court affirmed the right of shelter for homeless families. So now by 1986, anyone who is homeless in New York City is eligible for shelter. Next, please. Government expands its role. The Stewart B. McKinney Homeless Assistance Act. This authorized underutilized and unutilized public buildings to be converted into facilities to accommodate homeless folk. In 1990, there was a New York agreement for another 3,600 affordable housing units. And then Congress in 1990 established the housing opportunities for persons with AIDS. And then in 1992, the New York State Psychiatric Center's census was 13,000. Remember, in 1955, it was 96,000. And in 1955, where I lived on Long Island, there was a psychiatric institution called Pilgrim State Hospital. And there were 13,600 patients in Pilgrim State at that time. Next slide, please. This is an EAU. This is an emergency assistance unit. So this is what I'm talking about. These are folks who are trying to get services, and they would have to camp out in the hallways and sleep on the floor for days or weeks at a time. And 4 people in the Dinkins administration were held in contempt for the deplorable conditions in the emergency assistance units. The Way Home was a report submitted to the Cuomo administration by two Mayor Dinkins to address homelessness. And in 1993, the Department of Homeless Services was created as a separate agency. 96, President Clinton signs the Personal Responsibility and Work Opportunity Reconciliation Act, and this was the first step in welfare reform. And one of the goals was to assist needy families and to fight welfare dependency. So now these are solution-focused responses by New York. 99, another 1,500 units of affordable housing. In 2002, the Culhane report documents cost offsets for New York One supportive housing. And what this was a computation that was performed by the Coalition for the Homeless, which is a large nonprofit here in New York that focuses on the issue of homelessness. And what they found was that in 1999, it cost $4,400 to accommodate and provide services and deal with a street homeless person. That same person in an affordable housing unit would reduce that cost by $16,200. So it's cheaper to have folks in affordable housing as opposed to on the street and having to deal with outreach workers and the police and all the other support folks. In 2004, Mayor Bloomberg released Unifying Beyond Shelter, the action plan for New York City. And this was his attempt to really address homelessness in the city. And my boss, George Nashak, was in the Bloomberg administration, and he actually rose to the position of Deputy Commissioner for Adult Services. Now, one of the things George likes to highlight to point out how severe the crisis is here in New York is when he was in the Bloomberg administration, and at the time he left, the city budget for the Department of Homeless Services was $900 million. That was 10 years ago. This past budget, the DHS budget is over $2 billion. Next slide, please. So we take one step forward, take a couple of steps back. Once again, New York. The third agreement was signed for another 9,000 units. Bloomberg administration rolls out the Advantage program. And this was, once again, another Bloomberg attempt to address the issue of homelessness. DHS implements a street outreach program. 2008, the national recession starts, so that kind of impacts a lot of these policies. And then the Advantage rental subsidy program ends. Next slide, please. Now, this is an issue that's near and dear to me today, managing homelessness versus solving homelessness. In 2016, the homeless census reached an all-time high of 60,000 folks, and that number is even higher, and I'll explain that further on in the presentation. Mayor de Blasio decided to remerge the Department of Homeless Services with the Human Resource Administration. So now you have one super huge bureaucratic organization trying to address the issue of homelessness. 2017, you see what the New York Psychiatric Center's number is. It's less than 4,000 folks. So 50 years ago, there were 100,000 people in New York State receiving psychiatric treatment, and now there's less than 4,000. George seems to think that the underlying rationale behind deinstitutionalization was we have come up with all these great medicines and prescriptions to accommodate folks who are bipolar or depressed or anxiety ridden or schizophrenic. So as long as they have this medicine now, they don't need to be institutionalized. Well, no one thought of the great aha. And the great aha is that's fine, but what if they don't take their medicine? Then what? So that's an ongoing problem. Compounding it, Rikers Island census is down by 20% since 2002 and 58% since 1991. And the phrase right here is accurate: prison to shelter pipeline. You have inmates, Rikers, they're released, they have no place to go, they wind up on the street, they wind up in shelter. Mayor de Blasio releases Turning the Tide on Homelessness. And this speaks volumes to the issue of maintaining homelessness in New York City as opposed to eradicating it. This plan calls for building 90 new shelters over that 5-year period from 2017 to 2022. I always ask the question, why wouldn't you take the billions of dollars that you're spending to build new shelters and spend that money building supportive housing with the appropriate support systems to accommodate folks who are homeless as opposed to having them in shelters? 2017, Mayor de Blasio also signed a law giving homeless folk and people facing eviction legal representation in housing court. And that's going to prove important because since the pandemic hit in May, there were 8 million people in the United States that slipped into homelessness. The expectation was once this moratorium for rent moratoriums and housing moratoriums end, there will be 13 million people across the country that will be subject to eviction and therefore potentially homeless. And of course, New York will absorb a large portion of that population. And then finally, 2 recently adopted laws, class action settlement, CW versus the City of New York. After 6 years of litigation, it covers homeless youth in crisis shelters. 2020, New York passed a residential eviction moratorium bill protecting tenants from eviction through May 21st of this year. Next slide, please. So this is a chart prepared by Coalition for the Homeless. And you see it shows as of July 2020, there were 58,000 homeless folk in New York. That number actually is much higher because if you count the 4,500 street homeless folk who don't live in shelter, and you add those folks who have escaped domestic violence and they're living in domestic violence shelters, and you add other homeless shelters in New York City that aren't run by the Department of Homeless Services, that number grows to over 75,000 homeless New Yorkers. Now, to put that in context, if the homeless population of New York City was its own standalone city, it would be one of the top 10 largest cities in New York. The breakdown of those folks that we serve experiencing homelessness, 58% are Black, 31% Latinx, 7% white, 1% Asian, and 3% unknown. Next slide, please. And this is just a pie chart showing how this breaks down between children, adults and family, and single adults. And if you focus for a while on children, you'll see that there are 20,000, at least 20,000 children who are homeless. There are 1 million school children in the New York City public school system. Before COVID, it was estimated that at least 100,000 of those students, 10% of the population, was either homeless or unstably housed. Next slide, please. And here are a couple of books that you might want to take a look at for supplemental reading. Evicted, Poverty and Profit in the American City, and The New Jim Crow by Michelle Alexander. And then we can finish with the final slide, acknowledging that those charts you saw were prepared by Coalition for the Homeless. And that's it.
Thanks very much for that overview. And we've got some questions coming in. Maybe if I ask one question, so at each stage of your own experience, falling into homelessness and then later working to ameliorate it, what surprised you the most? Maybe not about yourself that you could have fallen into homelessness, but about the system. And what, if anything, about the role of race and all of that?
understand race had nothing, I mean, I know you're not saying this, I'm just saying that race had nothing to do with me falling into homelessness. It was my own stupidity, all right, and not planning for the future. So I have no one to blame but myself. But one of the things that has stuck with me and struck me the most and surprised me is I am at the tail end of my career. Couldn't be in a more rewarding position. But I truly thought that if I did a good job, I would be helping to shut Care for the Homeless down. If anything, we're expanding and growing by leaps and bounds. So the good news is I'm busier than I've ever been in my life. The bad news is I'm busier than I've ever been in my life. We've gone from a $19 million operating budget when I first got here to about a $37, $38 million operating budget now. We had one shelter, a 200-bed shelter in the Bronx for women living with mental illness. Since that time, we've opened another shelter, a 120-bed shelter on West 52nd Street in Manhattan for women living with mental illness. We're building an 80-bed safe haven right across the street from Lincoln Hospital in the Bronx behind Yankee Stadium for street homeless folk that Lincoln Hospital has been housing in their emergency room at night. And we hope to bring them into our safe haven. Safe haven is different from a shelter in that a safe haven deals with the folks who have no intent, no inclination to go into shelter. They'd rather stay on the street. So it's a little more secure. They have more privacy, and then we can move them into the shelter system. And then we're building 3 new shelters over the next 18 months. And one you alluded to at the beginning of the presentation, we're actually in conversations to build a $53 million shelter in the Bronx that we will in turn wind up owning the building. And it'll be for men living with mental illness. Because we have found that when we have a shelter and we have health services in the shelter, and we can buy continuity of care. So we are not transactional care for the homeless. We provide primary health, oral health, podiatry, behavioral health, optometry. And George always says from the day he first got here that he expects our clients and patients to receive the same quality of care that everyone on this call receives, if not better. So my greatest shock is that this is a problem that's not going away. This is a problem that has inculcated itself into the fabric of New York City. I am at 33rd and Park Avenue, high rent district, prime terra firma. I can walk out my front door and walk to Madison Avenue, and I'll see 2 or 3 homeless people sleeping on the street. Now, that can be quite depressing because I go away from that and saying, well, what am I doing this for? Am I helping to solve the problem? Because it's just such a large problem.
You talked a little bit about mental illness and homelessness. Can you tell me, one of the questions is, to what degree is it really a major contributor? How does it stigmatize homelessness? Does it draw our attention away from other factors that might contribute to more people, or what's the relationship?
Yeah, what I have found is there is no one size fits all when you're defining someone living, experiencing homelessness. A lot of our residents do have mental illness, but you qualify that type of mental illness. So, for example, in our 200-bed shelter in the Bronx, we have a lot of women who deal with anxiety, who deal with depression. And so they get counseling for that. Then we have some that might be more severe, might have a more challenging mental illnesses. You saw from the presentation that the institutionalization of New Yorkers with mental illness has gone basically from 100,000 to 0. So those folks had to go somewhere. So what we find is a lot of those folks are in the street. If I had to give a broad stroke number, probably a good quarter to 50% of folks living with homelessness or living with mental illness. So once again, if you're taking your medications, everything's fine. But what if you suffer from depression and you're not taking your medicine because you just don't want to take your medicine? What occurs then? We had an issue where because of COVID, we had to move all of our residents from shelter in the hotels. Well, for some folks, that was fine. But for some other women, that drastic change was difficult for them to manage emotionally. And so we had a few people that acted out, and because it was the wrong environment and it was a deviation from what their normal environment normally is. So it's a large component, but it's not the sole component and it's not the sole reason.
One person says, after seeing yesterday's New York Times report on rampant abuse in New York City shelters, how do we create shelters and facilities that help rehabilitate, protect, and truly assist the homeless?
You have to have folks like my boss, George Nashak. So you have to have people that are committed, and you have to have people that act with integrity. I do this, the money's important, but I do this for a purpose, not just a paycheck. And there was only one other time where I felt that rewarded in doing that. And that's when I worked for the mayor as the CFO for his political campaign. So it's a huge issue. You have some bottom feeders that want to capitalize off the plight of people experiencing homelessness. And you have some people that are using this as a money-making venture. Now, I'm not calling anyone out. All I'm saying is, why are we engaging developers to build 90 new shelters as opposed to engaging low income and supportive housing developers to do that? My view is it's because someone somewhere is getting paid.
One other person asked for a clarification. You mentioned building housing versus building shelters. How would that work? What would have to be done to make that happen is the question.
Well, you'd have to have the funding for it. And then it has to be part and parcel with support services. For example, we have not moved into that realm yet, even though our board is considering it at some point. But the Doe Fund is a nonprofit that gets ex-convicts off the street into shelter and then into supportive housing. So it's a three-step approach, and they get them jobs. And it's called Ready, Willing, and Able. And unfortunately, the founder just recently passed of cancer about a week ago. But they're building a 255 unit supportive housing building about a block from our health center in the Bronx, because we have a health center ensconced in the 200-bed shelter I mentioned earlier. So we're partnering with them. They're building the supportive housing unit where they'll house 255 residents in their own apartments. We'll provide the health services one block away. It's got to be comprehensive, and it's got to work in conjunction with continuity of care and providing the support services that the people need.
One of the questions, and I suppose you can say this is going to be an "it depends" answer, but what percentage of those supplied with housing and support, I guess would depend on the support, eventually leave to become self-sufficient, living and working on their own?
I can only give you an example. I don't know. I don't have absolute numbers and issue-wide, but I do have numbers related to Care for the Homeless. So each year at it's called Susan's Place, named after the previous executive director here. Of the 200 women that live there, each year we move about 100 into permanent housing. So over the last 10 years that the shelter has been in existence, we have gotten 1,000 women out of homelessness and into their own apartments.
Historically and in the present, what are the greatest unmet needs of homeless children, adolescents, homeless families? What are the best practices and policies to serve the needs of children, adolescents, and their families?
Well, I can give an example of one of the greatest needs. There is such a dearth of internet connectivity in homeless shelters. So you already had children who are homeless and they're at the margins academically because they're dealing with their homeless crisis already. Now they have to learn remotely. They may not have a laptop. They may not have an iPad. And if they do have a laptop or an iPad, they may not have the internet connectivity that's necessary because a lot of these shelters are housed in underserved communities. So there are nonprofits in New York that focus on the youth. We chose to focus on mental illness and healthcare because we are first and foremost a healthcare organization. Secondarily, we provide shelter.
One of the questioners wants to know, do you know if homelessness is worse in the United States than in comparably wealthy countries, Canada, Japan, Australia? And if so, how would you account for that?
Well, I've been to Canada and I haven't seen a plethora of homeless folk. I've been to Japan, I haven't seen a plethora of homeless folk. I have to be honest. Other than, for lack of a better term, poor third world countries, I don't think many of the leading nations around the world are facing the kind of crisis that we are in terms of homelessness.
One asks, would it be helpful to address the voucher system and how permanent support housing is not intended to shift people out of, but to keep them from experiencing homelessness and to get the care needed as different than other systems?
Yep, that's a hot button. And whoever asked that question knows about homelessness in New York City. One of the greatest complaints that our shelter directors have is that the vouchers that the residents have to obtain housing, a lot of the landlords won't accept it. And first of all, that's against the law, but it's fact. Secondly, the amount of the voucher in many cases isn't enough to provide the kind of accommodations that our residents need. So the voucher system definitely has to be looked at, definitely has to be revamped. And I suspect, that can's going to be kicked down the road and the next mayor will have to undertake the initiative of how to fix it.
So there are a couple of questions about the pandemic. One, many people said COVID-19 maybe shines a light on pre-existing inequalities. Are there ways that you've seen that it exacerbates it? Are there any concrete details or instances? And what would you say to someone who says that COVID is ugly to everyone regardless of race and housing status?
Well, I would agree with that. It is ugly for everyone, but I think it has drawn a bullseye on underserved communities. Many folks who are experiencing homelessness that aren't related to us don't have the quality of care necessary to even deal with the homeless crisis, COVID. And every year we have a memorial service. We have two primary events. One is a memorial service where we commemorate those folks who died while experiencing homelessness over the last year. We normally have that on December 21st, the winter solstice, because it's the longest night of the year. And then we have a spring celebration on June 21st, which is the longest day of the year. And we celebrate those folks that have gotten out of homelessness and have housing and have gotten a job, and we give them plaques and we really celebrate them. This year for our homeless memorial, we had 2 to 3 times the number of names to read of people who passed while being homeless than we did last year. So it's kind of a great cataclysm of events in that you're a person of color. So the statistics supposedly say that if you're a person of color, you're more at risk for COVID, and you're homeless. So again, that was the very reason why the city of New York moved all of our residents into hotels, because the thinking was they would be less at risk for infection if they're living in a hotel. But it kind of pulled the scab off the wound of the disparity in populations and the medical care that they receive.
One asks if are the doctors employees of your organization? If not,
Yes.
how do you find and develop networks of doctors who serve and deliver high quality care for your clients?
That's a good question. We deal with several search firms that focus on providing doctors, nurses, medical assistants, psychiatrists that understand what it is we do and are enamored by the mission. I mean, you have to want to do this kind of work. You have to want to be the kind of provider that wants to work with these underserved populations. Care for the Homeless is the only nonprofit in New York City that provides healthcare solely to homeless folk in New York. So people know that coming in, that our mission is to provide high quality healthcare and shelter the people experiencing homelessness and attempt to eradicate homelessness wherever it exists in the city. So it's a special kind of person we try to attract to Care for the Homeless. And it has its challenges. You know, there is a lack of nurses across the country nationally. So we're trying to play competitive we're trying to play in a competitive space and compete against the Montefiore's and the Columbia's and the St. Luke Roosevelt's and the Weill Cornells. And we can't offer the kind of salaries that those hospitals offer, but we can offer the satisfaction of working with a population that desperately needs the kind of providers that join us. And there's some value to working for us. There won't be extended work hours. You know, pretty much figure it's going to be a 9 to 5. We have a fairly rich benefits program. So we try to work to attract the caliber of provider that we need, but also we are mission driven and mission forward. So we make sure the providers we bring on board are wedded to the mission.
I want to combine one question I had maybe with one that someone else gave, but you sort of took us through some of the history of that. And we both remember a New York City that is hard to imagine now, places like the Meatpacking District or South that are spots we couldn't afford, that were spots we would have been afraid to go to once. If you think about all those changes over the years, how the city has developed, where resources have been put, as a person, as an advocate for the homeless, are we any better off, worse off? And the question that came was about developments like Hudson Yards, and those things where huge sums of money are going in. How do you evaluate the situation we're in with homelessness, with the way money's been spent on things like that? I guess they want, what, $1 billion now to build a platform to build more buildings there or something?
It speaks for itself. I mean, it speaks for itself. It speaks for itself. The fact that you have the largest development project in the country taking place right now at Hudson Yards. You have a 70 or 80 story building going up on the Upper West Side, whose back faces a homeless shelter, that the residents of that high rise got an attorney to try to prevent the Department of Homeless Services by populating that building with residents. So, you know, there's this huge NIMBY attitude in New York, not in my backyard. I support the homeless folk. I'm an advocate, but I don't want them to live near me. And so it's somewhat depressing when I drive to work in the morning, because I come right down 34th Street. So I come past Hudson Yards every day. And that's just one of 30 construction projects just in Manhattan I probably could point out, where folks seem to be able to find the billions of dollars to do that kind of work, but they can't find the money to build supportive and affordable housing. So it's a choice that needs to be made that's not being made.
If a Holy Cross first-year student were on here and saying, what can I do as a student? What should I do now as a first-year student at Holy Cross in terms of curriculum, co-curricular? Would you say just get out there and work somewhere and volunteer? What would you say about the curriculum? What he or she should do?
There's a shelter. I'm sure there are a few shelters in Worcester, because I've been shocked by the degree of homelessness in Worcester when I come up to visit, seeing all the folks panhandle. So I would say if there's a shelter where you can volunteer, do so, and then come next fall, talk to Pam Ahern and see if you can get into the internship program and come work for us at Holy Cross South.
And what do you want them to have learned in their classes to see from there? What are you looking for when they come in the door?
That they have an interest in nonprofit. If they have an interest in one of the young ladies that interned for me is a young woman who graduated in 18, Daniela Fazio, and she was a pre-med major. And she interned for me and absolutely loved the experience. She was involved in SPUD at Holy Cross and had worked in a women's shelter. So when she came to intern, I knew she already was interested in serving this kind of population. So it was easy to make that decision to hire her. So the commitment to the underserved, I think, is dramatically important for me. I don't just speak about Holy Cross's motto of men and women for others frivolously or lightly. I try to live it. I try to get others to live it. And I try to make it part of my daily routine and how I think. Because when I was homeless, I've told Tom, one of the reasons it only took me 6 months to go from sleeping on a roach-infested floor with no valuables and nothing to my name except 3 wardrobe boxes of clothes to being the CFO for the mayor of New York was I had a lot of fancy and influential friends. And at the end of that experience, I said to all of them, I could never thank them for everything they did for me. And unequivocally, they said, we don't expect you to. We expect you to do it for someone else. And that's all I did.
We have some great questions, but I think that's an awfully good way to end. And I appreciate that. It is 5 o'clock and we try and stick to an hour. I'm sorry to those whose questions I couldn't get to, but I'm really grateful to you for showing our students what's possible and helping us to understand in New York City's context, the depth and reality of the homelessness situation. So thank you very much, Ron.
Thank you, Tom.